My name is David Wortley. I'm a non-executive director of the World Lifestyle Medicine Education Services, and I'm making this video as a recording of a presentation that I made at a conference in Prague on July the 8th. It was a presentation about lifestyle medicine and preventative healthcare. So without further delay, I'm going to start sharing my screen. Thank you for taking the time to watch this video. I'm David Wortley. I'm a non-executive director of the World Lifestyle Medicine Education Services, and I'm also a vice president of the International Society of Digital Medicine. I want to begin by making it quite clear that the views and opinions that I express in this video, they're entirely my own, and they're based on my own personal experiences as a lifestyle medicine practitioner and explorer over the last 11 or 12 years. And they're not intended to endorse any of the products or services that I've used or tried out and that I mentioned in this video recording. I'm going to begin by introducing myself and saying a little bit about myself and the objectives of this presentation. This is a recording of the Google Earth journey from where the conference took place to my home in the UK. So the video zooms in, as I'm based in the UK. And the reason why this is that lifestyle medicine depends on ability and social their ability to practices. So you can see that I live in the countryside in a little village called Alderton, which is based in Northamptonshire. It's a very pleasant village because it's in the countryside, and because of my personal circumstances, I am able to make the time to walk 5 miles every day and live in pleasant circumstances where I have the benefit of living a lifestyle where I'm in control of much of what happens in my daily routines. And this is quite important. I'm affiliated to the British Society of Lifestyle Medicine, and in my role as a non-executive director of the World Lifestyle Medicine Education Services, my job is to support the commercialization of commercial support by developing partnerships that provide opportunities for the British Society of Lifestyle Medicine to customize lifestyle medicine education packages for their partners. And I want to take the opportunity to promote the British Society of Lifestyle Medicine annual conference, which this year is being held in Brighton in September. And I do encourage you, if you're able to join this conference, to take part in it because it's one of the most rewarding and productive conferences that I've ever been to. So I hope to see you in September in Brighton. So the main takeaway from this presentation is that lifestyle-related non-communicable diseases are one of the biggest challenges to the sustainability of public health services. And technology-supported lifestyle medicine, which can influence our personal behaviors, such as exercise, diet, nutrition, hydration, sleep, and social circumstances, make an important contribution to addressing this challenge. So I want to explore some of those challenges that we all face today, and I've exemplified this by the picture that I'm showing, AI-generated picture that I've shown here, which is intended to show the growing influence of artificial intelligence and robotics within medical practices. So this is also an AI-generated video clip intended to illustrate some of the circumstances that still exist in the UK today and certainly were present during the times of COVID, where people were having to be looked after in a hospital corridor. So health services today are under a lot of pressure. So part two of the presentation looks at non-communicable diseases and what impact they have on our health services? Well, non-communicable diseases such as cancer, diabetes, related conditions, cardiovascular health, etc., mental health situations, they are becoming the biggest cause of death worldwide. And you can see from this graph how they've grown since 1900. So they primary cause of death today. And communicable diseases have mainly been addressed through vaccination programs, etc. And other types of deaths such as accidents and suicide, etc., are also on the growth. So we die from lifestyle-related conditions, or we have an early mortality from lifestyle conditions increasingly today, and it represents an enormous challenge to the sustainability of public health services. But the good news about the developments in medical technology is that life expectancy has improved tremendously, particularly over the last half century. So you can see from this graph that in the 1800s, life expectancy for many people was only 32 years old. Whereas today we have a majority of the world's population and life expectancy in the area of 70 years. So longevity has increased dramatically. And whilst this is a good thing, it has led to the challenges of the aging society. And these challenges are reflected mainly because of our increasing longevity, but the fact that we need more medical care as we get older, and there are fewer working people to be able to support our extended lifescale. And in the UK and many other places, elderly care is underfunded. And I'll go into a little bit more detail about that shortly. Pandemics have only exacerbated the problem. So we live in an atomic society, and during my lifetime, the way in which society has changed has meant that instead of older people living in the same household as their children or grandchildren, increasingly the children and grandchildren have moved away from home, and so older people have found themselves having to be looked after within their community rather than by their own family. And this has led, in many circumstances, to a lot of loneliness and social isolation. Also, because people are living longer, because they have increasing health challenges as they age, there is a comorbidity challenge. And the video on the left was an AI-generated video of my partner's father, who lived with us for the last year of his life. And on the left-hand side of the table, you can see the number of drugs that he used to take, not necessarily on a daily basis, certainly, but on a weekly basis. And those drugs didn't always agree with each other. But in the last few weeks of his life, when he was to be clear that he was not long from leaving this world, his daily drug regime decreased dramatically. So these number of drugs cause problems with themselves, but of course they also represent a cost burden to our national health services. So to summarize, we're living longer, but we need more healthcare as we age, and this is causing an imbalance in the cost of our health services, and resulted in potential financial unsustainability of those health services. So the nub of it is that we need to have a strategy which shifts from a mantra based on cure to prevention. And key to doing that is changing our lifestyle behaviours. This was pointed out by the former head of the National Health Service, Sir Simon Stevens, some 10 years ago, when he recognised that these challenges of the ageing society were leading us towards a cliff edge. And if we didn't do something about preventing the health problems in an older age, we would face complete disaster and meltdown of our national health services. And to a certain extent, he's been proved correct. What he did say was that in order to do this, we need to do something about addressing our lifestyle behaviors, and we need to do it as early as possible and make this transition from cure to prevention. And this is a strategy that's very much in line with our new government's practices and strategy. So we have modern technologies, but can technology help to solve this problem? Because the challenge is that we need to influence lifestyle behaviors, and we need to do it not only on an individual basis, because everybody is different, we also need to do it at scale. So the solution that I adopted in my own lifestyle medicine journey was based on a personalized, gamified, but medically validated behavioral change. And this is essentially what lifestyle medicine is all about. So I'm going to go into a little bit more detail about lifestyle medicine, what it is, and how that influenced my own personal health journey. Well, lifestyle medicine, it's described on the BSLM website as evidence-based clinical care that supports behavior change through person-centered techniques that improve mental health, mental well-being, social connection, healthy eating, physical activity, sleep, and the minimization of harmful substances and behaviors. And it's based on three principles. I mentioned that I'm fortunate enough to live in a nice house in the countryside, and to have a lifestyle where much of what I do on a daily basis is under my own control. But this is not true for everyone. And we need to acknowledge the need for people's social and economic circumstances as determinants of health. And we need to develop these clinically validated, proven techniques to support people to help make these lifestyle changes. And this is based on education and a knowledge of the six pillars of lifestyle medicine, which are healthy eating, mental well-being, healthy relationships, physical activity, the minimization of harmful substances like tobacco and alcohol, for example, or other forms of social drugs, and sleep. In order to do that, in order to make these changes, it's important that we are able to, in my opinion, to measure these key influences and to create our own personal benchmarks. If we're going to make improvements, we need to know the starting point. And with gamification practices, we need to set goals for ourselves which are achievable, to build a supporting environment that help us to achieve those goals. Digital technologies and digital therapeutics can help in this process. But at the end of the day, it is all about encouraging personal responsibility for our own health. So what role does technology play in all of this, and what role did technology play in my own lifestyle journey? Well, I'm going to begin by looking at the way in which some of these technologies have evolved over the last 12 years that I've been practicing lifestyle medicine. And what I learned in that time is that one of the most important things is diet. Although I started my journey by focusing on exercise, diet is probably the most important factor in all of this. And so looking at the what I call the first generation of technologies that influence diet, I started with a device called the Jawbone Up that allowed me to monitor my calorific intake and make sure that I expended more calories than I took in. But then these evolved into technologies like the Fitbit, which was primarily a fitness tracker, but it did also record sleep, and the Fitbit application gave recommendations for diet. So these are screenshots from my own Fitbit. that cover how your diet was recorded and how it assessed the nutritional value of that diet and gave recommendations for the type of food. Now, these types of applications have evolved to an involvement with the use of epigenetics and take into account your personal profile based on your DNA. And this being used to calculate an optimal diet and exercise plan and offers diet advice for personalized diet, exercise, and nutrition. As I said right at the beginning, my disclaimer, this is not meant to endorse this product. It's meant to show how technology has evolved. And Moodoo was designed initially for elite athletes to help them to get optimum performance through their diet and exercise. And this is how Moodoo used epigenetics. You sent off a sample of your sputum, and it used that to analyze your body composition and your personal response to different factors within your lifestyle, exercise, stress, etc. And it gave personalized advice on your exercise and your diet. And again, it provided some examples of diets that were likely to be beneficial to you. The next generation of diet technologies is basically a proof of concept, but it takes into account the influence of any drugs that you might be taking. And it was developed by a company called Precision Life, based in Oxford, experts in the use of big data analytics, primarily for drug discovery, but they also developed this proof of concept, which was amplified by this persona of a character called Albert. So this is Albert, this is his persona. He had various medical conditions, but he also took drugs for tackling those medical conditions. And this application was developed to take into account the kinds of food that might benefit him. So as I say, it's a proof of concept, which takes into account epigenetics, factors in his personal profile, factors in the drug regime, and provides advice which is there for him when he does his shopping. So it suggests the type of food that is going to be best for him. And if there is a food that is not so good for him, it would suggest alternatives. And what I describe as a fourth generation application, something that I'm exploring at the moment, and that uses blood glucose sensors. I'm using a blood glucose sensor at the moment, which tracks my blood glucose levels. And originally it was developed for diabetics, but there is a version developed for non-diabetics who are interested in managing their own personal health better. And I use it because it gives me a better understanding of the impact of my diet and my exercise regimes on my blood glucose levels. And the device I use happens to be called Lingo. And here are some screenshots that give you some indication of what the spikes on the blood glucose monitors show, what they represent, and give you some education on how to address those. So for the future of diet and nutrition, which as I say, I think is extremely important, it's going to be increasingly personalized. It's going to be based on our DNA makeup, medication, and it will make increasing use of artificial intelligence and machine learning. And it will help us to monitor our diet by recognizing both purchased food and cooked food and calculate the nutritional value. And I think in the future, we're going to see more and more of these personalized food delivery services, both cooked meals and food services for delivering fresh food to your door, which are based on your own DNA and your own optimal diet circumstances. And all of this eventually will be monitored by biometric devices through wearable devices like the lingo that I've just said. So this is where I started my journey, and it was based on exercise technologies. And I'll just play you an extract of a little karaoke style video that I made to show that my journey through this process.
Down on the couch, David used to sit, bag of chips and a soda hit. Doctor said, boy, you best beware. Diabetes knocking, you gotta care. Now he's walking miles, counting his way, 10,000 steps each and every day. Sweat on his brow, but a spark in his grin. David's life ain't the same as it's been. Strapped on that tractor, red numbers told. Let that story about his health unfold. No more burgers, late night fries. Traded them in for clearer skies. Now he's walking miles, counting his way, 10,000 steps each and every day. Sweat on his brow, but a spark in his grin. David's life ain't the same as it's been. He's strapped on that tractor, red numbers told. Let that story about his health unfold. No more burgers, late night fries, traded them in for clearer skies. So
the mobile apps that I used right at the beginning from a product called Jawbone Up, but I've used a variety of different trackers, all of which basically have a very similar approach. They measure your sleep, they measure your physical activity, and give you an opportunity to record what you eat, to measure your diet and give you sort of feedback on that. And you can see the kind of results that it had in my case. The picture on the left was taken in the mid-1990s. You can see I'm carrying a lot of weight. I'm still carrying that weight in the 2000s. But in 2013, when I started, you can see a picture of me in May 2013 rather, when I was involved in a play. And it was a combination of circumstances that led me to try and make some improvements to my lifestyle behaviors. And within a few months, I lost a lot of weight and my appearance had improved dramatically. We should also think about hydration. I have a technique to remind me to take 8 glasses of water every day. My technique is to have a pint glass on the kitchen surface so that when I go in for either for going for breakfast or go in for tea or go in for lunch, I'm reminded to have some water with that. So, but there are technologies you can use to give you nudges and prompts that help you develop these new habits. And it's about developing good habits and avoiding old bad habits. With sleep, the important thing for me, I think, was to make sure that I get a regular bedtime, which in my case is about between 10 and 10:30 every night. But I have wearable devices that measure the quality of my sleep, and I keep an eye on that. What I have found is that hydration is also an important factor with sleep. And also social circumstances and mental health are very important with sleep. If you've got too many things on your mind, they're very disruptive for your sleep. Like stress management technologies, there are technologies now that help you to meditate, help you to record your feelings during the day and provide a range of different techniques to help you to manage your own stress management. And finally, social support technologies. And I mentioned earlier on, we live in an atomic society where children move away from home and they don't live in the same family house and support their parents as they get older. So technologies like Facebook Portal and Zoom allow families to connect and keep close together. And all of these things are important, but nothing is more important than, I think, face-to-face contact and relationships with people that you care about and that are involved in your daily life. So, bring to the presentation to its conclusion, I found that a range of different lifestyle medicine practices are been absolutely crucial in helping me to age healthily. But I also want to make the point that we live in a society which, during my lifetime, people's perception of older age possibly hasn't changed because my father died when he was 69, and he was mentally and physically an old man by that time. But today we have opportunities to age more healthily and to make a contribution to society for much longer. And so this means I'm making a plea now that we uh, don't regard older people as a burden on society. We give them the technologies and tools to help to manage health throughout our lifestyle, not just when you get older, and give us control of our own health. And we need to change our perceptions, I think, to think of older people as an asset and not a liability, because older people have an awful lot to offer. You might say that I'm saying this because I'm 76 and I still feel that I've got a lot to give to the world that we live in, and I'm very keen to do that. I think there's a lot of people like me who just want the opportunity to make a contribution through their lives. So if you are interested, you're watching this and you're interested in discussing with British Society of Lifestyle Medicine or the World Lifestyle Medicine Education Services, ways in which you can partner to develop customized education services for your staff or your own circumstances, you can contact me at my personal email address, and I can discuss with you ways in which we can work together to make improvements to your individual health, but also if you're involved in running an organization. I think it's very important to provide these kinds of facilities to help your staff maximize their lives and optimize their performance at work. So that is me. I'm a lifestyle medicine practitioner and evangelist, and I hope that you gain some benefits from this presentation. Thank you.